Well, I'm here attending ASCO meeting in Chicago, and I will present the results of the COLUMBA study, a phase 3 non-inferiority randomized trial in which dara-IV, the conventional route of administration for daratumumab, will be compared with dara subcutaneous in relapsed and refractory myeloma patients. And the rationale for this study is to try to optimize the administration of daratumumab because the time of infusion for dara-IV is quite long, 7 hours for the first infusion, 4 hours for the second one, and 3.5 hours for the third and subsequent ones. So this is a non-inferiority study, and 522 patients were included. And in order to demonstrate that dara-SC is not inferior to dara-IV, two co-primary endpoints were evaluated. First was overall response rate, and the overall response rate was 37% in dara-IV, 41% in dara-SC, slightly higher for dara-SC, but anyway no differences, so dara-SC is not inferior to dara-IV. And the second co-primary endpoint was maximum concentration through evaluated at the beginning of the cycle number 3. And again, both concentrations for dara-SC and dara-IV were comparable. This means that dara-SC is not inferior to dara-IV. But well, there are some additional advantages if we consider the use of dara-SC that I think that are important from the clinical point of view and with a clear impact in the clinical activity. The first one is the time of infusion, because dara-IV required long infusion times, while dara-SC can be delivered in 5 minutes since the first administration. Most importantly, when we evaluate the safety profile, especially infusion-related reactions, dara-IV resulted in 34% of infusion-related reactions and dara-SC in only 13%. This means that in addition, the infusion-related reactions are significantly lower. In addition, well, a satisfaction questionnaire was done to the patients in order to evaluate what was their perception, and it was much more better for dara-SC than dara-IV. So I would summarize that dara-SC is not inferior to dara-IV in terms of efficacy, in terms of pharmacokinetic, and if we consider that it's much more convenient, patients have to be at the hospital for shorter time than when they receive the dara-IV. Together with the lower rate of infusion-related reactions, I can say that in the near future, I think that all patients in which dara is planned as part of their line of therapy will be administered in a subcutaneous way.